Welcome back to After Surgery. What the I'm Dr. Benjamin, and today we're delving into something super common. You pretty much get it with every surgery. It helps reduce swelling, supports your healing tissues, and it encourages your body to really settle into that new look that you got, and that is compression garments. Your garment, depending on what kind of surgery you have, you're gonna have a specialized garment. Now, patients get pretty crazy about this. They want to buy 2-3 different garments, especially even before surgery, and I always recommend against it. I know you want to wash different ones. That, I usually tell my patients you can be outside the garment for at least 60 minutes so that you can wash it, especially after liposuction, because it can get kind of dirty, of course. But I would really sort of frown upon buying too many garments early on, because remember, guys, you're going to have significant swelling after surgery. As that swelling comes down, your garment's going to get super loose. So if you bought 2 or 3 garments, they can get really expensive. Now 3 weeks later, you're buying different garments. I usually give my patients their first garment, and that's really mostly what you're going to need in that acute 6-week healing phase period. So just be patient with it, of course. Your garment should always feel snug and supportive, but never painful. If you're wearing a garment, for example, arm liposuction, your hands shouldn't be numb. You should be able to use your hands. It sounds like common sense, but that's the thing. You don't want your garment so tight that's actually cutting out blood circulation. When it comes to, for example, the fajas that we wear for liposuction, now those are critical. It helps maintain your blood pressure, helps really smoothen out the contour. But if we did some aggressive liposuction, if we're hitting that 5 to 6 liter limit, it's really 5 liter limit, and you're wearing too tight of a fitting garment, you can actually increase the chances of obtaining what's called a liposuction burn, where you're really compressing the skin. We've already beat up the skin from the inside. Now your garment's so tight, you're beating it up from the outside. That skin's not going to tolerate that. And that's how you end up with those types of complications. So it's super important to wear, properly fitting garments that are smoothened out. So that's a key element. Make sure your garment is nice and smooth along the skin, especially in areas where the dermis is super thin, like the arm, the inner arm, or for example, the anterior abdomen or the lower abdomen. Any wrinkles in that garment are going to translate into wrinkles in your skin. Your body heals by creating collagen, especially those first 3 weeks. We create space when we're liposuctioning, for example. Your body's going to fill that space with either fluid or collagen or scar, and it's just going to throw it down. It remodels over the course of the year. So if your skin is wrinkled, and your body's throwing down collagen, guess what? You're gonna have a permanent crease that now you're stuck with. And the only way typically you're gonna be able to loosen that crease up, ideally lymphatic massages can help, but you may need to go back to surgery for us to break up that scar tissue. So you don't wanna be caught in that situation. And that's why I always couple my garments typically with a very condensed white foam that goes underneath the garment that should be right against your skin. This isn't just any foam, because it needs to be a high grade, high density foam so that as your swelling comes down, that foam's against your skin. It doesn't shear your skin so you don't get blisters on your skin. So all of this process is really sandwiched in, and the post-op care is so integral into getting you back, the shape that you want, exactly the results that you want, and as fast as possible. So common mistakes that I see, in garments and when patients buy garments is typically they're wearing the wrong size. And that's very common, because you don't know how much you're going to swell. So you're trying to hit a moving target, because as you heal, your swelling is going to come down and it may loosen. That's totally fine. Typically, patients are taking it off way too early, or they're not wearing it 24 hours a day, especially during those first 3 weeks when you're going to have the most inflammation, or they're stopping too early, or they're wearing garments way too long. Now, some patients after 6 weeks buy what's called a stage 2 faja if they did, lipo 360, and that's totally fine. Beyond 3 months, you're really not helping yourself. If you're wearing compression beyond 3 months, typically what you can get is called rebound congestion or rebound swelling. Remember, that garment's also squeezing down lymphatics. So if you wear it like 3-4 months out, even if you haven't had surgery and you wear a faja, as soon as you take that faja off, those lymphatics are going to dilate. They're going to reopen. So it's normal to get some rebound swelling, and probably around 5 to 7 days after you take the faja off if you've been wearing it regularly for several months. Most patients wear compression for several weeks. I pretty much mandate most of my patients wear compression at all times for 6 weeks. With the exception of neck lipo, because I know most patients don't want to wear that garment. So I usually tell them first 3 weeks for 24 hours and the latter 3 weeks for at least 12 hours a day. But the more you wear it, the better your results. And those first 3 weeks are honestly the most important. That's when your body's going to be throwing the collagen down. That's when you want to make sure that your skin is nice and smoothened out. Compression becomes a concern, again, if it causes numbness, severe pain, or sharp pressure points. Those are, if you're having sharp pressure points with wearing your garment, that's a warning sign that something's not right. So you need to readjust your garment. You may need a new garment altogether. Compression isn't about discomfort. It's about supporting that healing process and helping you get the best results possible by allowing your body to heal and deposit that collagen circumferentially, tightening the skin. So it's a whole package deal, guys.